Let's discuss part 2 of the blood vessels. When we look at the vascular system, we discussed this when we discussed the heart. We have two circuits. We have a pulmonary and a systemic circuit. And the pulmonary circuit is here to have the blood be picking up oxygen and getting rid of carbon dioxide. And the systemic circuit is here to deliver the oxygen to the body tissues and pick up the carbon dioxide, as well as delivering other nutrients and picking up waste products. The main artery is the aorta, the biggest one, that comes off the heart, as we discussed. It reaches over as an arch, first an ascending aorta, then an aortic arch, and then it goes down the thoracic area first, and then the abdominal area. So it's the descending aorta is a thoracic part, and then once it pierces the diaphragm, it's a aortic part. The first three things that come off of the trunk are the ascending, or the brachiocephalic trunk as well. Then that feeds into the right subclavian and the right carotid. From there, they're shunting off. And then the next two vessels coming off of the aortic arch are the left common carotid going to the head, and the left subclavian going to the upper extremity, the arms. As we come further down, we have the aorta shooting off branches that go to the bronchus, that go to the esophagus, etc., that feed the tissues in the chest area. So we have an esophageal artery, we have a bronchial artery, we have intercostal arteries, even subcostal arteries. Costal means ribs again. And then we go into the descending the abdominal aorta part as we pierce the trunk. We have a celiac trunk that goes to the liver. We have a renal and the suprarenal arteries that go to the kidneys as well as the adrenal glands. We have mesenteric arteries, two of them, and they go to the gut. Then we have gonadal arteries. They go to the gonads, the testicles as well in the male, and the ovaries in the female. And then terminally, as we get towards the bottom of the pelvis, we're going to split the arteries into common iliac arteries that go into the leg. They feed into a common femoral artery. So the femoral artery, as you look at the name, runs by the femur. So you can then often associate the names of an artery with the name of a region of your body, which feeds back to that first chapter where we had all these body regions. So the femoral artery, the popliteal artery is the back of the knee, and then we feed into a tibial artery, and on the medial side, a posterior tibial artery, anterior tibial artery, and then a peroneal artery where the fibula runs, which the muscle, we have a peroneus muscle there, we call it the fibularis now. Who knows, in 10 years we will call it the fibular artery, or we don't know that, but we might. Those are the main ones that go down into the leg. The pedal area has a pedal arch where around the toes that vessels make a loop. And then when we look at the upper extremity, we start with that subclavian artery as it comes off either as its own self on the left side, or it shoots off right off the brachiocephalic trunk on the right side. We feed then under the axilla, the subclavian artery changes its name, becomes the axillary artery. And as it goes into the upper arm, we call it the brachial artery. And then the forearm, we got one that runs by the radius and one that runs by the ulna. So we call them a radial artery and an ulnar artery. Those are the main ones up in the upper extremity. And that's pretty good as far as I'm concerned in terms of what we need to remember. We can do much more detail, of course, but again, we have a freeway system, that's the vascular system, and as we get smaller, we get into the regular country roads and so forth, and we can look that up in the next class, that's more detailed. In terms of the veins, if you look at the veins, very similar to the arteries. A lot of times the name is given by the body part or by the bone, or the bone's also given the name by the body part, that it runs. And so look at that. We have a brachial vein, we have an axillary vein, we have a cubital vein, which is in the front of the elbow. But we do have another pair of veins in the arms and in the legs. We have deep veins that are named after the structures, which we just named them. The brachial vein is a deep vein that runs through the muscle system that we can utilize the muscular pump properly. And then we also have superficial veins, and they run more on the surface. And they are different because the arteries do not run on the surface that way, because we don't want them to bleed us out if we get caught or if we have an injury that way. And so in the upper extremity, the big one is the basilic vein as a superficial vein, as well as the cephalic vein. And then in the lower extremities, in the legs, we have the long and the short saphenous vein that runs superficially. Sometimes we could take a saphenous vein to fix a heart vessel problem. Sometimes they use that structure to help with that. Then the head is kind of interesting. One of the things with the brain is that it needs a lot of oxygen. So it will need a lot of blood. And so we want to always perfuse the brain properly with blood. So we have a system that is sort of a double system that comes into the brain. So we got the main common carotid that either comes off the brachiocephalic trunk or directly off the aortic arch, and it will split at some point into an internal carotid artery and an external carotid artery. By the way, the reason why it says common carotid versus just carotid is that it will split at some point into two. And here we have an internal that will go to the brain and an external carotid that goes more to the facies and the outside structures. And then the internal carotid goes into the brain, and we have cerebral arteries. We have a posterior, we have a middle, and we have an anterior cerebral artery. I'm not too worried about those names in this class, as long as you know the carotid. What I do want to though bring across is that we have a second system, and the second system is the vertebral artery. And the vertebral artery travels through the neck vertebrae as a transverse foramen, and it will then enter the brain more posteriorly and becomes a basilar artery as it then feeds into the posterior cerebral artery. So the blood coming from the vertebral artery generally feeds the back of the brain, the posterior portions, and the ICA feeds the middle and the anterior portion. And then the key here is that they are connected. So the whole brain, all those cerebral arteries are connected and make a loop, so to speak. And they call that the circle of Willis, Willis at times. Good. All these names, put some into your brain. We're not going to be too picky about them testing-wise because a lot of it is deductible. You can make up the name as you go along. When we come to blood pressure, arterial blood pressure, we say that BP, is the pressure against which the left ventricle must eject the blood. So the left ventricle is the blood ventricle that sends the blood, the heart ventricle that sends the blood to the whole body, the systemic circuit. So that pressure needs to be strong enough that we can push through the peripheral pressure of the blood vessels. The pressure wave that is created can be felt in superficial arteries, or arteries that are more to the surface than the only deep. We have some in the brachium, but we also have a femoral down by the leg. When we measure blood pressure, which is those pressures against the walls of the vessel, When the heart pumps hard, that's a stronger force, as we can measure that. We call that a systolic reading. That's the higher number, the first reading that is. And so remember, systole is when the heart contracts. And then the other one, when the heart does not contract, when it's relaxed, in diastole, we call that the minimal pressure during ventricular relaxation, and that's the diastolic reading. And so a normal resting blood pressure is 120 over 80. Once it reaches 140 over 90, it's called hypertension. Sometimes they even go a little bit further. They call pre-high blood pressure the one above 120 to 140, as well as between 80 and 90 on the diastolic pressure. The pulse pressure is the difference between the systolic and the diastolic pressure. So if we want to figure out a pulse pressure, and normal resting pulse pressure will be 40 millimeters of mercury. That's the difference between 120 and 80. Declining elasticity of the arterial walls is known as arteriosclerosis. And that is pathology that raises the diastolic blood pressure. First the diastolic, followed later by the systolic. And then that one will remain high, even when we sit down. So we have to be more concerned when the diastolic pressure is also high and not just the systolic pressure. And when we take a blood pressure, which is a good thing to do, because the reading is helpful to understand what the heart is doing and sort of the arterial system, what that's doing. And the technique is quite simple. We have an inflatable rubber cuff with a manometer reading, which that reads the pressure. And that thing is placed on the upper arm, as you can see in the picture, with the patient seated. The measurement should be heart level. So you want to have the patient seated. You don't want them to hold up the arm. You want to kind of hold the arm or have the arm be relaxed. And then when that cuff is put on that upper arm, we'll inflate it until it completely occludes the brachial artery. So we go way above the 140 and we squeeze everything together. And then we slowly release the pressure and we listen with a stethoscope. And when we hear a pulsating sounds, then we see that a continuous sort of pulsating sounds come through. We know that's the systolic blood pressure, because that's the pressure that lets the heart push blood through that little small hole that is created by squeezing the vessel. So that will be then the systolic pressure, and then we keep decreasing the inflated cuff, and it gets louder and louder and louder and louder, and then it gets softer and softer and softer, and at some point the auditory thing disappears and you can't hear it anymore, and that is then the diastolic pressure. And the sounds really are caused by the blood having to push through, and it creates turbulence on the side of the vessel walls, and that's what makes the sounds that we hear. Good. Well, here is all that we covered in the second part and the first part. And I hope you get an understanding of what I'm trying to convey to you. Thank you.